Hello, it's Dr. Mogga. Okay, so what advice can I give you as a young woman who is a medical student or medical resident? If you are to have a partner, maybe you're married or you're cohabiting during your training, I'll strongly advise you to hold off on having children during that time. Delay as much as possible until you have finished your residency. And I say this all too well from my own experience. I had a baby in my 4th year of medical school, and going into residency with one baby was extremely hard because you have an extra challenge on yourself. I'll just go on and say it. Most residencies do not factor in a full-time mother and do not factor in the time you need to take care of yourself and your family. Use contraceptives. Seal that uterus until you're done with your residency, because it was so hard. It was so hard. I would not go through it again if I had to. My children are the love of my life. They're my blessing. But during my residency, I had my 2nd child in my 1st year of residency, my 1st child in my 4th year of medical school. They are blessings and I welcome them with open arms. Now, when I look back, the challenges I had compared to my other residents was just so much. I'm sure they could not have a concept of it. How can I say it? Having a newborn, you are on rotation. You're expected to be there at 5 a.m., 6 a.m. Pre-round on your patients, go through rounds with the team, do your duties as a resident, give sign out at the end of the day, go home. But what I had to do was breastfeed a child in the middle of the night. I was on night duty until the child was 3 months, at which point we put her in a daycare. Now I had 2 children in daycares, at the same daycare. I have to carry their stroller and a car seat. There are times when I just was so sleep deprived, was going around like a hamster on a wheel. I didn't have time to study, okay? My partner is from a typical African household, and even though I can say he helped, the majority of the childcare fell on me. Feeding the babies fell on me, making their breakfast, packing their lunch, packing their clothes and their change into their baby diaper bag to drop off to the daycare. That fell on me. Weekends were the busiest. When I was off on the weekends, it was from morning till nighttime labor. Okay? Cleaning the house, cooking fresh meals during the weekends, shopping for food. Every morning, I'll go to the grocery store. I'll try to make my babies something fresh to eat as they became toddlers. And that was my entire residency. It was just like that. Give them a bath, wash their clothes, fold it, make sure the bathrooms were cleaned. I went to bed at midnight, almost daily. Once I put them to bed at 10 p.m., I would go study for 1 hour, 1.5 hours. And then put in time you want to spend with your family. I literally had no time for myself, no time to make friendships, to keep friends. If the residents were going out to have a good time at the bar, and those times are important. You need to be with your colleagues. That's when you learn what's going on in the department, the politics. I couldn't do that. Had to go home. Okay? If there was an evening presentation, I could not do that. And yeah, I would advise you, put that baby maker on lockdown until you finish your residency. You will have so much more control as an attending to raise a child, and your finances will be in a better position. If I had to do it all over again, okay, I will not have a baby in residency. But let's say you do have a baby in residency. I would pay for a nanny. I would hire a nanny. I didn't have the foresight because coming from the culture that I was, it was unheard of to have a nanny in your house at night to help you. But in hindsight, I'll take a loan and pay for a nanny so that I could get a full night's rest. I would give up on the baby breastfeeding. I know it's good for them to do it for a whole 6 months, purely breastfeeding. But boy, as a resident, I went back to work after 6 weeks because that was it. I had 2 weeks of vacation and 4 weeks of family leave. And you know what? The residency will make you pay back that extra time because the ACGME rules for residents only gives you 2 weeks a year for vacation. So that was the most time I could have off with my baby. And it wasn't enough, right? So I wanted to continue breastfeeding, but just kind of have this picture of you, trying to force that baby to feed before you go to work in the morning. And they're not. They're just sleepy. They don't want to. And then you go to work and in the middle of the day, your nipples hurt. You start leaking. You have to find a bathroom. You don't even have time to pump. That's the problem. Because you just barely have time to go get food, bring your food back, sit in the residency room or in the small corner that was assigned to your group and eat your colleagues or look up labs or things on the computer, and you're constantly answering pages. When you're unattending, you can have way more control over these things. But as a resident, you are at the mercy of the program you've joined. Pregnancy brain, baby brain, whatever you call it. Lack of sleep, hormone changes, postpartum depression, all of those things can take a number on your concentration. I had my child in my first year of residency in December, but the next 3 months were extremely hard. It was hard to keep concentration, hard to keep awake, hard to maintain the same amount of energy, because when you went home, the work did not stop. You were on duty. And then add to that a child getting sick, right? A child getting sick, having a cold, staying up with the child, or a child being fussy, or a child crying. I think I became numb. I just had to survive each day. Then I took my surgical rotation. As a PGY1, we have a surgical rotation for 3 months. I took it, I think, in the last 3 months of the year. That was a mistake because, oh my gosh, virtually impossible. Q3 call, trauma call. Anyway, that's my advice.